A bone marrow transplant, also known as a hematopoietic stem cell transplant, HSCT, is a medical procedure that involves the transplantation of healthy stem cells into a patient's body to replace damaged or diseased bone marrow. Bone marrow is the spongy tissue found inside bones, and it is responsible for producing blood cells, including red blood cells, white blood cells, and platelets. A bone marrow transplant can be a potentially life-saving treatment for various conditions, including certain types of cancers, blood disorders, and immune system disorders. There are three main types of bone marrow transplants. Autologous transplant. In an autologous transplant, the patient's own stem cells are collected before undergoing high-dose chemotherapy or radiation therapy. After the cancer treatment, the collected stem cells are infused back into the patient's bloodstream to restore the bone marrow's function. Allogeneic transplant. In an allogeneic transplant, the stem cells come from a compatible donor, often a sibling or an unrelated donor with a similar tissue type, human leukocyte antigen, HLA. This type of transplant carries a higher risk of complications but also has a potentially curative effect for some diseases. Syngeneic transplant. In a syngeneic transplant, the stem cells come from an identical twin, making this the least risky type of transplant since there is no risk of graft-versus-host disease, GVHD, a condition where the donor cells attack the recipient's body. Here's an overview of the bone marrow transplant process. Pre-transplant evaluation. Before the transplant, the patient undergoes a thorough evaluation to determine their overall health and the suitability of the transplant. This includes medical history, physical examination, blood tests, imaging, and other relevant tests. Conditioning regimen. Before the actual transplant, the patient may undergo a conditioning regimen, which involves high-dose chemotherapy and/or radiation therapy. This is done to eliminate the existing bone marrow and make space for the new stem cells to grow. Stem cell collection. For allogeneic and autologous transplants, stem cells are collected from the donor or the patient, respectively. The stem cells can be obtained from the bone marrow itself, peripheral blood, through a process called apheresis, or umbilical cord blood from a newborn. Transplantation. On the day of the transplant, the collected stem cells are infused into the patient's bloodstream through a central venous catheter. The stem cells then travel to the bone marrow and begin to produce new blood cells. Post-transplant recovery. After the transplant, the patient is closely monitored for potential complications such as infections, GVHD, in allogeneic transplants, and other side effects of the treatment. Supportive care, including medications and blood transfusions, is provided as needed. Engraftment. The process of the transplanted stem cells establishing themselves in the patient's bone marrow and starting to produce new blood cells is known as engraftment. This typically takes a few weeks after the transplant. Long-term follow-up. After the bone marrow transplant, the patient requires long-term follow-up to monitor their progress, manage any potential complications, and support their recovery. Bone marrow transplant is a complex procedure with significant risks and potential complications. The success and outcome of the transplant depend on several factors, including the patient's underlying condition, the type of transplant, the compatibility of the donor, and the patient's response to the treatment. Patients undergoing a bone marrow transplant often need to stay in the hospital for an extended period and may require